Advantis interrogates the Trust's Patient Administration System, or PAS, to find patients. The safest way to search for your patient is to use a unique identifier, such as the district or NHS number. If you only have the patient's name, you can do a surname search, followed by a comma, and then their initial. For example, Irene Watkins would become Watkins, I. This format is important, otherwise the system will require a date of birth. Let us take a moment to demonstrate this. We're going to type in Watkins. We will be asked to refine the search with the use of a date of birth. However, we're going to click on the Home button. If we type in Watkins Irene with no comma and then click on Search, we will still be asked for a date of birth. The system presumes anything without a comma is just a surname. We'll click back on Home. This time we'll type Watkins, I and then click on Search. The first initial is sufficient to find a list of patient matches. Interestingly, even if we had typed Irene's full name into the system, it would still only recognise the first letter in the surname. So now we're going to search for our test patient. So click on Home. This time we're going to type in a case note number. In this example, we're going to use a test patient, so type in ZZ4 and then click on Search. You are taken through to the patient summary screen. Check the name and date of birth. Check that you have the correct GP here. Check this against the notes, in particular the nursing notes used to book the patient onto the ward. There is a chance that GP details might not be updated on the system. If there has been a change, then you'll need to notify the ward clerk or nurse in charge that Advantis needs correcting. Doctors do not have access to amend patient details in Patient Centre. However, this is critical to the HCR as the hospital care record is the document that is sent to the GP informing them that their patient has been admitted. If the incorrect GP is recorded, the patient's actual GP will not be notified and any GP follow-up you request will not be actioned. The risk to the patient's care is significant. So please take the time to check this information with the notes. Below this we have a list of case note numbers. Here we can see an old case note number and a P number for psychiatry, but you may also see M and MM numbers for maternity patients and N numbers for babies. We will select one of these in a moment, but before we do, let's take a look at the Patient Alerts and Co-Morbidities link. Alerts and markers are added by specific teams, for example, infection prevention, dementia and diabetes teams. Further alerts can be added by nurses in handover. If you're a doctor, you will have access to add alerts, but we ask that you leave this to the appropriate teams and the ward nurses. However, both nurses and doctors are responsible for adding the co-morbidities, and these are required for the HCR. There is no way of adding alerts or co-morbidities from within the HCR itself. Click on the link to edit co-morbidities. Click to add current smoker. Click to add renal failure. Notice that you can remove these by clicking the delete link here. However, we're happy, so click on Back to Patient. We are taken through to the patient correspondence list. However, Advantis CDS is much more than a document management system. It also acts as a portal into information shared with other systems. Notice the tabs at the top of the screen. Currently, Correspondence is selected, but doctors and nurses have additional tabs. Importantly, we have the SHCR, Stockport Health and Care Record tab. This allows you to view a summary of GP and some community service information about the patient. More on this later. Let's click on the History tab. Here we can see if the patient has had any sensitivities recorded against them. This can be useful, but please be aware that EPMA also contains drug and non-drug allergies and sensitivities. Information on allergies and intolerances that have been recorded in the GP system can also be seen in the SHCR. As a nurse and doctor, you can add sensitivities as appropriate. It is simply a free text box. Below this we have the ED comments. If you work in ED, you'll be given guidance around the use of this tool. However, as nurses and doctors working on wards, you should refer to the ED attendance record for a complete record of what has happened to the patient. Click on Reports. Here we can see a summary of reports that are available in Advantis. You need to be aware of the limitations here, as it would be dangerous to make clinical decisions based on an incomplete patient's record. Firstly, we have the old emergency department documents. Click on the arrow. You will see a list of all the ED attendance records pre-July 2013. After this date, ED went fully electronic, and therefore the most recent ED summaries can be found in the correspondence list. Select the ED attendance record for the 20th of July 2012. As you can see, the document gives a very basic overview of what has happened during the visit. Click on the Back to Patient button. Click on the drop-down for Review. Review is the system used by the Trust to view and sign off results. Please note that only the signed off results appear here. This is not a complete picture of the patient's results. If you are a doctor of the appropriate grade, you are reminded that you have a duty to sign off the results. This shows that the results have been viewed and acted upon, but also allows them to be pulled through to Advantis so that they appear here and are also available for attaching to GP advice letters. Click to select the full blood count on the 24th of June 2014. Here we can see the result details. Click to return back to patient. You may get other options here dependent on the departments that the patient has been to. Here we see an endoscopy report. And here we can see that the patient has 7 radiology reports. Click on the arrow for the radiology reports. At the Trust we use packs to view images and reports, but the reports can also be seen in Advantis. Click on the Radiology US Abdomen Report on the 12th of September 2013. Please notice how clinical history has been pulled through from the original order that the doctor placed. Orders are placed in Patient Centre. You need to take care when placing an order that you include all the relevant clinical history and, importantly, the question that you want answering. Click on Back to Patient. Trust scan documents are scan letters of referral to consultants. These are useful if you are working in a clinic area, but remember that the outcome of clinic appointments are available in Advantis CDS as an outpatient advice letter. However, the Trust is currently migrating all paper-based notes in the patient's healthcare record onto an electronic system called Evolve. Click on the Evolve tab. Because you've already searched for your patient, you're taking it into Evolve in the patient's record. There is separate training for Evolve, but if you have entered via Advantis, you can use the cross to log out and return back into Advantis. Pathway is a functionality currently under review. This leaves a Stockport health and care record. This is a summary of information held on the patient in the GP system. It is a valuable tool for checking what medication the patient is on and giving you a more complete picture of the patient's care on which to base your decision. If the patient has an EPAC or end-of-life portal for anticipatory care record, then the tab will be slightly different and it will look like this. So we have seen the way Advantis CDS acts as a portal into other systems, but now we need to understand the use of CDS to view documents created within the Trust. Click on the Correspondence tab. The status column tells you whether a document is open and can be edited or if it is locked and can no longer be edited. When you hover over the ED scan documents, it tells you that it has been published. Published documents cannot be unpublished and they can't be edited. When you hover over the ED attendance record icon, you're told this is an open document, which usually means you can edit it, but here you can see that it has also been locked and therefore can't be edited. Open documents look like this. To view a document, you would click on the document's title, which is blue to indicate it is a link. However, be very careful for HCRs. Notice here that the title for the HCR is black and the Click to Create link is blue. You must only click on the Click to Create link if you actually want to start the HCR. For now, click on the Outpatient Clinic Advice Letter dated the 13th of the 11th, 2013. The document opens. You can use the mouse wheel to scroll up and down the document. If the text is too small, you can hold the Control key down and use the mouse wheel to magnify. Alternatively, you can right-click, click to select the Zoom tool. And if you right-click again, you can get a menu and you can select Fit Width. Notice the document control bar on the right. Publishing is handled automatically by Advantis CDS, so this button should be left. Attached document is useful, so give this a click. Click to view the AFP, dated on the 13th of the 11th, 2013. Click the cross to close the report window. Click on the Back to Document Control button. Click on Locking and Ownership. Here it tells you that the document has actually been published and therefore the document can't be amended as it has already gone to the GP. If you did need to amend a published document, then you would need to send another clinic advice letter informing the GP that there is an amendment required. Here it tells you that the document is in gastroenterology group, and this means when it is scanned into Evolve, this is the section that the document will be stored under. Click on Back to Control. Document Mask allows you to hide a document if it is incredibly sensitive. Print and Send is quite self-explanatory. However, Document History is useful as it shows all the people that have edited and viewed a document. Click here now. Document History has the most recent activity at the bottom of the list. If you need to check if someone has changed a document or if they have viewed it, then you can see this via the audit trail. It is also useful for publishing information, as you can see, particularly with the HCRs, whether you can go back in and edit it. Click on Back to Document. When you want to view or work with another patient, click on the Home button. When you've finished with Advantis CDS, then please ensure that you log out. You've just seen how much information you can access about a patient, and you've seen the level of audit trail that is maintained by the system. Do not leave your password open to abuse. Click on Exit. Notice that you're still logged onto the intranet and the Advantis icon is still displayed. Remember to click on Log Out. This video tutorial is over and you will be returned to the e-learning.